my name is Tracy. I'm in section 2. I'm going to be demonstrating a primary IV administration or medication administration. So let me come in. Good morning. My name is Ashley. I'm your nurse today. Can I get you to state your name and date of birth for me? All right, Mr. Jackson. So your doctor's ordered some vancomycin for you. Have you ever had vancomycin before? Yes, you have? All right. So you didn't have any kind of reactions to it or anything like that? Nope. Do you have any other allergies? Do you have any allergies to alcohol or any other kind of medication allergies that I need to know about? Nope. All right. So I'm going to go get your medication ready for you, okay? All right, so I'm going to check my MAR. The doctor ordered 500 milligrams of vancomycin Q6 hours in his peripheral IV. So the bottle contains 500 milligrams per 1 milliliter. So I'm going to give him 1 milliliter of vancomycin in a 100 milliliter IV bag. And it's going to run over 60 minutes. It's going to be 17 drops a minute. So vancomycin is an antibacterial. I'm going to go to my drug book and I'll look at the action, the purpose, the dose, the side effects, contraindications, nursing implications, and the infusion rate, which is 60 minutes. So now I'm going to mix my medication for Mr. Jackson. And I already assessed his labs. His bun and creatinine are within normal limits. And all of his other baseline labs are within normal limits as well. So I'm going to go ahead and put my gloves on. Okay, so I'm going to get 1 milliliter of vancomycin. Go ahead and clean off the top of the IV bag too. And this would go in sharps. I'm going to gently mix it. I'm going to add my label to the back, and that's going to include the client name, drug, dosage, time, and my initials, and the date. I'm going to go ahead and spike my bag. I'm going to prime my chamber. And I'm going to put a label on my tubing. It's going to do the date, time, and my initials. So go ahead and hang his medicine. And I clamped back the medication so it wouldn't run everywhere. Now I'm going to get my ASASH procedure ready. Get my ASASH ready, so I'm going to get 6 milliliters of saline. this would go in sharps as well. Get my alcohol. I'm going to check his IV patency. Make sure there's no redness, phlebitis, infiltration. I don't see any. Do you have any pain right there? No. Alrighty, so I'm going to go ahead and wipe off his port with some alcohol. Okay, and I'm going to go ahead and I'm going to aspirate first. Make sure I got a blood return. Right, and then I'm going to do 3 milliliters, push, pause, push, pause, push, pause. Okay. And then I'm going to wipe off his port again. And I'm going to use meds. Connect it. Make sure it's not clamped. Make sure it's running. And I'm going to check the side again and make sure I don't see any phlebitis or infiltration. And I'm going to set my flow rate to 17 drops a minute. Make sure he's flowing good. So his flow rate is at 17 drops a minute. And I'm going to check his site again, make sure it's in there. Make sure there's no phlebitis, no infiltration. Now document how he tolerated it. And then I'll be back in an hour, Mr. Jackson, and your medication should be ran through. All right? Knock, knock, knock. Hi, Mr. Jackson, how you doing? I see that all your medication is ran through. How are you feeling? How's that IV feel? Good, I'm going to check the patency of the IV, make sure there's no phlebitis or infiltration. It looks good, I don't see anything. All right, I'm going to finish my ASASH method. I'm going to flush it with 3 milliliters of saline. So I'm going to clamp you off. Make sure you're not running or anything. Go ahead and get my alcohol, my saline. I'm going to go ahead and unhook you. And I would put a new alligator clamp on here so another nurse could use it after me. So I'm going to clean off his port. And I'm going to flush, finish flushing with the other 3 milliliters with the push pause, push pause, push pause, push pause, push pause. Ready? I'm going to check the side again, make sure there's no phlebitis or infiltration. Looks good. How are you feeling? Good? Alright. And all of this would go in the sharps. And if he had a PICC line or a central catheter, we would have done the H in ASASH, the heparin, but since it is a peripheral, we're not going to do the H, depending on protocol. So I would document that I used my MAR to verify the medication. At 0300, the vancomycin 500 milligrams was given peripherally. No phlebitis was seen, no redness, swelling or inflammation, at the IV site or infiltration, 50 milliliters of saline used to deliver med in mini bag. And I'm going to record in my mod that in my documentation that I'm going to look at intake and output. So this is what I'm going to record or document.